Everybody, good morning. I say good morning because Steve and Jay and I are on the West Coast, and it is still morning here. For many of you on the East Coast or the Central, it's already afternoon. A couple of housekeeping duties before we get started. This workshop is on assessing and managing risks in the new era. What's the same, what's new, and where do we go from here? We have two delightful presenters. Jay Satz is from the Northwest Youth Corps, and Steve Smith is from Experiential Consulting. They have presented at this conference previously when we did it in person and helped us a whole lot early in the pandemic with a risk management workshop on COVID-19. I'm delighted that they're here. The instructions on the conference, the Whova website said to post questions in the quick Q&A box on that. If you ignore those instructions and instead post any questions that you have in the chat box here on Ring Central, that would help us keep track of them so we don't have to jump back and forth between the workshop announcement and this page. So with that said, at the end of the workshop, if you would fill out the evaluation that's on the workshop page on Whova, that would be wonderful for us to get your feedback. And with that said, Ricardo Diaz is also with us, and he's a staff member at the Core Network. So thanks for joining us, Ricardo. So with that, I'll turn it over to Jay and to Steve. Thanks again for offering your services.
Thanks for that kind introduction, Alan, and it's a real pleasure to be back with all of you at the Core Network. I have a sense of deja vu. About 1 year ago is when I last was on an airplane in Washington, D.C., being introduced by Alan for a talk I was giving with Jay. So here we are in this new virtual world. We would like you to please drop into the chat your name, your preferred pronouns, where you're zooming in from today, and what organization or program you're representing here today. And that'll give us a nice sense of who is in the room and allow you to start interacting with each other. Feel free to turn on your cameras, and we're going to have a very interactive session today. So just wanted to front load that. So I'm Steve Smith from Experiential Consulting based out of Seattle. And we are a risk management consulting firm that uniquely works with outdoor and experiential education programs like conservation corps, outdoor education programs, wilderness therapy programs, and so forth. Before founding Experiential Consulting, I was the risk management director at the Student Conservation Association for 5 years, and I've had a long career at Outward Bound as well, all of which has set me up beautifully to understand what's happening in the outdoor industry and to be able to help outdoor organizations with their risk management efforts. Another big piece of that was the 3 years that I was fortunate enough to serve as the chair of the Wilderness Risk Management Conference, which many of you have attended or should attend. And if you're interested in what Jay and I are speaking about here today, I would suggest please do join us at the Wilderness Risk Management Conference at some point in the future. I think you'll really get a lot out of that community and out of that experience. So it's a real honor to be presenting with my friend and colleague Jay, and I will turn it over to him to introduce himself.
Oh, thank you, Steve. I am Jay Satz. My personal pronouns are he, him, his, and I am joining everybody from Tacoma, Washington. I'm with Northwest Youth Corps and Idaho Conservation Corps for my day job, and I serve there as Senior Director of Partnerships and Innovation. Had 29 years in doing risk management work and program operations for the Student Conservation Association. And then in my spare time, I'm on the board of directors of Erie Backcountry Medicine and the Greater Seattle YMCA's Camping and Outdoor Leadership branch. And I'm lucky enough to do some consulting work with Steve on occasion. It's really great to be here. I will say also that I was feeling that sense of deja vu that both Alan and Steve were talking about, having been in the Core conference. Steve and I did meet in the airport as we were leaving the Core Forum last year, guessing that that was the last time we were going to be on an airplane for a while, but we didn't know how significant that was. And it's interesting that we were presenting on mental health issues, which was a growing, emerging concern in the core community, and frankly, in the outdoor community around how we can best serve our members, our participants, our staff. And it's easy to see how very important things can sometimes get sidetracked, and that's going to be a theme that's running through our presentation. And we're going to talk a lot about risk, but before we get going, I just want to remind ourselves and congratulate ourselves for being here a year later. I think Mary Ellen mentioned yesterday in her opening that out of 132 conservation and service corps that were faced with the threat of COVID to our very existence and operations, that we're all still here. And that is an amazing testament to a lot of different things, but particularly because resiliency is in our DNA. That's what we're hoping to imbue in our members. That is where we are coming from. And so it's great to see so many of you here, and we really, really appreciate it. Remember that in March and April of last year, corps were trying to decide whether to continue to operate or not, and needing to figure out whether we could actually work in a COVID environment, or whether we needed to shut down and steward our organizations until we could reopen again. At Northwest Youth Corps, we canceled all of our spring programming. We didn't go back into the field until May 22nd. But when we did, by the time that we were done, we had over 500 participants in 3 states, and we had no COVID at all in our crew-based operations, and we had 4 cases of COVID in our individual intern programs, only one of which was work-related, which was a fairly extraordinary example of the core community as a whole in being effective in this environment. So welcome, and Steve, I'm going to turn it back to you.
Great, thanks so much. So I hope you all had a chance to introduce yourselves. Thank you for doing that. I'm going to run through some of the objectives we have for you today. We're hoping that after today's workshop, you'll be able to apply. This is why we do this stuff, right? So that you can apply these concepts to your own programs. Self-assess any potential areas of concern or gaps or blind spots that may come up for you as a result of what we talked about today. And we're going to do this very interactively. So if you're not ready to be engaged and to talk with each other, you may be in the wrong place. And we want you to be here with us. We're going to use chat. We're going to use some third-party software called Jamboard and the Mentimeter, which we're about to do. I'm going to actually drop into the, Ricardo, I got this one. I'm just going to drop into the chat this website. And I'm going to ask you to click to open up a separate little browser window, go to menti.com and punch in that code, and you'll be set up to be doing this next part. We're going to use breakout rooms at one point, so you'll be in some small groups working with each other. And at the very end, we're hoping to just unmute microphones and have a bit of a chat with any remaining time that we have. So really looking to be not just drawing on the experience that Jay and I are bringing, but tapping into the smart people and the expertise that is here in this virtual room with us. So on that note, we'd like to talk about how COVID has impacted the core community. And before we do that, I'm going to invite you to go into that menti.com chat link that I just shared. And what's going to happen is it's going to ask you 3 questions, or to give you a chance to answer 3 questions, put in 3 words. And I'm going to share that screen with you so that we can see together what kind of a word cloud that we're all going to make together using that software. So go to menti.com, punch in that code, and let's see what we all come up with. And maybe I need to reopen the voting. Just a second. here on that. Bear with us. So, voting should not be closed. Sorry, we were just playing with this right before. Oh, it's not letting us vote. Wonder why. Let me see if I can get that going. Stand by. Okay, it should be working. Are people able to vote?
Still closed.
Oh no. Okay, well, let's do this. Let's we'll work on that behind the scenes. Why don't you just drop into the chat? Go ahead and drop into the chat like some of the specific risk management challenges that you all encountered this year. And I think that'll just be a nice way to set the framework for some of the wide range of ways in which people were challenged by various risk management aspects this year. So we just invite you to drop that into the chat. Thank you, everyone dropping your thoughts into the chat. That's great. And let's see what we're getting. A real wide range of things. Transportation, a common theme. How to evacuate people who are showing symptoms. Housing challenges, a very common one. Testing availability. I love how diverse these first 5 answers really are, showing the real range of field-based and administrative things in our control, out of our control, physical distancing, board liability, vehicle and building occupancies, transporting members, that's a really common and recurring one. Facilities that were closed, maybe not by you, but by the partners that you normally work with, right? PPE availability, which is the right kind to use. So many different great answers here, really showing the range of different types of things that people were dealing with. Staff availability, a really key one, right? Differences in your organization and your partner's procedures, right? So how do you decide which one to use? Changing policies based on CDC and state changing guidance. Yeah, absolutely. These are really wonderful answers. So thank you. Thank you for sharing this. I'm sure you have more. Let's look at just some of those broad categories that those answers fit into. We certainly, obviously, on the financial front, we were all heavily impacted on that level. PPP loans and other strategies might have helped us make it through, but definitely big financial impacts. A lot of the things that you just mentioned in the chat were operational types of challenges, from the office to the field to the vehicles to the liability, of the organization itself. Issues with partners who might have different policies, procedures, or might be working at a slower or faster pace than you are in developing your own policies and procedures. So that was an interesting challenge. The staffing of your programs themselves, not just with crew leaders in the field, but in the office. The communities in which we operate. This was an interesting one to see emerge around the country in different ways, where a lot of the places where we run our programs themselves normally are quite excited to have us there, serving their communities and working in the field and all that. But there were times when gateway communities into national parks and such. Moab was a really great example of this, but I think there was lots more. We're like, we love you, we want you here, but not now. And this is not a good time for our community to be overwhelmed with our healthcare systems and so forth. So, the impact on search and rescue organizations and stuff like that was another really interesting one to look at over this past year. Mental health, Jay mentioned it at the outset, and certainly, COVID has presented us with, I think, several waves of challenges. And one is the obvious medical, wave of people impacted by or dying of COVID. But then the financial wave, and then the mental health wave of challenges that we as core programs have faced, and then our country has faced as well. And Jay's going to dive much more into this final bullet in the coming slide here. But COVID has unevenly impacted our world. And I think it's also been very interesting to note how it's also created equity and inclusion challenges for conservation corps and outdoor programs as well, who may be committed to their equity and inclusion goals, but struggled to meet those goals during the pandemic. And Jay's going to unpack that last one in a much richer way. So thank you for jumping in. I'm sorry the Mentimeter voting didn't work, but I really appreciate you dropping all those things right into the chat. And we'll just keep rolling with our talk here. So Jay, we're going to turn it over to you to talk a little bit more about that last bullet point and expand on that.
Yeah, thank you, Steve. So again, as we go back to imagining what life was like a year ago in our professional world in mid-March, there was so much that we didn't understand about COVID. We didn't understand what impacts were going to happen. And as we learned each piece, we worked together in ways that I think were unprecedented in the core community to figure out how we were going to build protocols in order to be able to work. And we were focused on managing infection. That's what we were doing. We did not have an understanding in March and April that we clearly had by the end of May about how COVID was inequitably impacting communities of color. We were just all dealing with it. We were there. We started making some decisions that allowed us to operate. And it was only after those decisions were made and the protocols were designed that we started realizing that we were essentially managing pandemic through privilege, that a lot of what we needed to do in order to make things work in our new world bent towards privilege. And some examples include one of our primary successes was in making a determination as an industry that rather than trying to figure out how to protect core members from each other in all of these environments, what we needed to do was assemble healthy family units. And so when they were together, we didn't worry about protecting them from each other. They were a family. They were all together. We needed to worry about protecting them from outsiders. We needed to protect them from, Forest Service and other agency coordinators that were coming to visit them, or from me when I was visiting a Northwest Youth Corps program. So we built these healthy family units, but the way we started out was requiring 14 days of self-isolation, which immediately bent towards you needed to have a stable housing situation. You didn't need a paycheck to feed yourself for those 14 days. Once it was a matter of working to get towards from where you lived to the program that you wanted to serve in, many corps, including Northwest Youth Corps and Idaho Conservation Corps, discouraged folks from using public transportation. We were not at all comfortable with how other people were using protocols. So that bent towards folks that had the ability to get themselves in a private automobile or vehicle. Another thing that we worked really hard on over the past, and we've talked about this at both the Wilderness Risk Management Conference and the Core Forum for several years, is how we were moving away from what we used to call medical screening, with the idea that screens are designed to keep things out, and we are building our programs on the foundation of diversity, equity, and inclusion. How can we support pre-existing medical conditions, mental health issues, other things on our program? And we've made great progress in doing that. And yet many of us, and I'll be transparent, that was happening at my organization, we went back to medical screening. We were so concerned about what it would take for our staff to manage all of these new protocols for COVID and how to be ready to respond, that we were less comfortable bringing on pre-existing conditions that we had been successful at accommodation in the past. So we became more rigorous about screening those out instead of evaluating and including. And there was just the larger issues around what it would take to run our programs. We are very, very proud of our American Sign Language Inclusion Program at Northwest Youth Corps. And that also required us to do significant amounts of in-person recruiting. And we found it very, very difficult to do that. And we ended up not running our program. We had a specific lens on how things were in April that we had to extrapolate into the summer. And we just didn't know how things were going to work. So we also were serving the Native American community through our Native Stewards program, and the Chamawa Indian School, which was a tremendous partner for us, sent all of their students home, and we didn't have access to those students. And now it continues, right? As we're moving through getting ready for our next phase of operations in year 2 of COVID, how is the vaccine rolling out? Inequitably. Where is it available? You know, we don't know. And to not just talk about COVID, because the larger issue, the whole issue around Black Lives Matters and racial equity and justice is creating some fascinating risk management scenarios for us as organizations, particularly working in rural America. We're now at a point where when we're successful in our diversity, equity, and inclusion goals, we're providing opportunities to bring folks that are perhaps underrepresented in some of the sites that we serve into areas where their comfort level is significantly reduced based on what's going on politically in our country. So we really have a lot of concerns that are going on, and we'd like to hear about yours. So Steve, do you think we can take another try at technology here with this Jamboard activity?
Absolutely. And Ricardo, if you don't mind dropping that link in there, what I'm going to do is invite everyone to follow the link to this Jamboard. I'm going to share that screen. I'm going to try to. And I will explain what we're doing momentarily. And let's do it like this. Let's go to the Jamboard. You should see now this Jamboard screen. I see a bunch of people popping in. If you're familiar with Jamboard, you know what to do. If not, there is a little toolbar on the left side of the screen, and you can grab a sticky note, and I'm going to show you what that looks like, and you can write your brilliant answer right on the sticky note and add it to the screen. When you add your sticky note to the screen, you can drag it to an open space. And if you see another sticky note that's really similar to yours, you can kind of lump it together with that one and help us organize. But this is sort of an open-ended question for you, and it's building on the great job Jay just did in kind of outlining the many ways in which privilege has been part of the story of how we have managed our way through COVID. And I think it's really important to acknowledge that and to provide some examples. You know, what role has privilege played in this story so far? And by identifying it, hopefully we will be better able to recognize that and find better ways in 2021. So people are starting to drop their sticky notes onto the board. Thank you for that. And just, they all go into the exact same spot when you drop it on. So please drag it to an open spot when you drop your sticky notes. And I'm going to try to just organize things together. Some great answers coming in already, I can see. We're going to give you some time to think about this and do this. These are great answers. Thank you all. So we're definitely seeing some housing related themes, and that's a matter of privilege. Absolutely. How someone's personal family may be impacted by COVID and access to medical care. And I would maybe add to that, along with pre-existing conditions and so forth. Lack of access to testing in a rural community. That's a good one. Lots of answers in the bottom left-hand corner here around internet access, access to computers, internet technology, so forth. Personal vehicles or the lack thereof and the effect that that can have, having to rely on public transportation or not allowed to use public transportation perhaps, right? Returning from our programs back to vulnerable communities. And I think that one here kind of relates to this one as well. You should be able to see my little laser pointer as I'm looking around at different things. Hate crimes, anti-Asian rhetoric and other kinds of hate crimes that we've seen proliferate during this pandemic. Let's see, there's one in the upper right-hand corner here. The AmeriCorps stipend financially prohibitive for members whose parents lost jobs. So it's not just the impact of COVID itself, but the ripple effect of the financial impact on the larger community. IT knowledge and training, knowing how to use Zoom. Thank you for that one. Increased crimes and car break-ins for those with everything they own in their car. Thank you so much for adding that. That's again, these are not COVID impacts necessarily. They're more like the downstream ripple effects on folks. And it comes back to this question of the role of privilege and what effect that's had on our abilities to run our programs. Health vulnerabilities, another one like that. Stigma around having COVID and being exposed to COVID. That's an interesting one. High visibility Trump signs displayed in the rural communities in which we serve. Really good, excellent job of using the Jamboard here, folks. Jay, if there's anything you see that you'd like to highlight, feel free. And I'd also welcome anyone that would like to expand on their sticky note or make a connection between things that I'm missing. Feel free to unmute yourself and just jump right in if anyone has any comments they'd like to make.
I'm not going to respond specifically. You've brought a lot of great ones up, Steve, and there's a lot more. But I do want to highlight what you said. That's for us to think about it, is that these are not as much COVID related. There's a few that are, as much as they are revealing of these issues that we are dealing with in our day-to-day lives, in our society and in our culture. And I think that is a theme politically, culturally, ethically, of COVID in the world right now. It is providing a lens on all of these things that were almost as significant an issue before COVID, with the exception that COVID added an extra life and death piece to the implications and impacts of these inequities.
Mm-hmm. Yeah, well said. Okay, well, thank you all for jumping in and doing that. And I think this really pops out some brilliant personal examples that you've all experienced of that previous slide where Jay was talking about the role of privilege. So let's stop sharing that, and we're going to go back into sharing the PowerPoints. And Jay's going to talk about this very interesting lesson learned along the way.
We're still not seeing the PowerPoint, Steve.
Oh, really? Okay, let me try again.
You are, which is good.
There.
I saw it, Steve.
Yeah,
Okay.
I saw it too.
Okay, it is, Jay, you might just need to swing back from Jamboard over into your Zoom.
Indeed, I do. Yeah, so this is a reminder to ourselves that it's great to effectively manage risks, but you also need to manage perceptions of risks. And you notice that there's a little box there that says, "Why no masks?" That eventually appeared on every single social media post that Northwest Youth Corps, Idaho Conservation Corps did, but it didn't immediately do that. And we realized that it was great that we were putting all of this effort into providing and building safe teams, healthy pods that only needed to be protected from outsiders, but not from each other. But we also needed to let people know that that's what we were doing. And we have a tradition called the Big Clean, which is essentially the demobilization of crews in our Eugene headquarters. And our neighbors were very, very concerned to see groups of young people coming back from their 5 weeks experience, healthy, successfully having had no COVID on their programs at all, engaging with each other without wearing masks. And our neighbors were infuriated with us. And we had a wonderful, thoughtful employee that thought that she could be successful explaining to this on social media, which rapidly turned into a disaster that luckily was very contained. But so this is just a reminder that not only do we need to do our due diligence in our risk management, but we also need to be incredibly transparent, and we need to think about how it is portrayed out in the real world.
Great. Thank you for that. Great lesson learned along the way. And, you know, again, it's not just the medical risk of COVID here. You know, that's the topic. It's the full suite of organizational risk, reputation risk, relationships with our communities. And I think it's easy for us to kind of get, Jay said this in his presentation yesterday, but, you know, we can get focused on COVID as the bright, shiny object in the room. That really distracts us from the full range of other kinds of risks that we're still managing all the time. So let's dive into that a little bit more. And something that COVID taught us is that some old school traditional ways that we've always done it, and old ways of thinking about managing risk, that I think have served us well in some ways over the years, simply didn't hold up against the continuously dynamic shifting landscape of the pandemic. And it invited us to be more agile and to start kind of diving into more dynamic ways of assessing risk. So we're gonna be academic here for a few minutes, and I'm gonna share with you a little bit of risk management history. And it's interesting to note that this model, the domino model, actually is a very prevalent, widespread way for people to think about risk management, whether you know it or not. Whether you actually recognize this model here or think about that as your operating system, This is actually an incredibly influential way of thinking about assessing and managing risk that goes all the way back to the 1930s. And what that says to me is that the prevalent way that a lot of us think about risk management is almost 90 years old now. And it invites us to think about maybe some more current thinking. So let's take a look at the domino model. And this comes from a guy named William Heinrich, who wrote a very influential book way back in the 1930s. And I want to make sure I get William Heinrich's book title properly here. So Heinrich wrote a book called Industrial Accident Prevention. And his idea was that when an injury happens, as you can see on the right end of the screen, it's caused by the action of preceding factors, things happening in the social environment. Someone makes a mistake. There's a mechanical or physical hazard of some sort. An accident occurs and someone is injured. And this is a very, as you can see, linear, static, predictable way of sort of creating a convenient narrative around an incident or an accident. And it invites us to simply find the broken domino. What's the broken piece in this system? What's the broken component? How can we fix it? In Heinrich's view, it was usually a human being's fault. He believed that 88% of incidents were caused by human error. So that was something that he drew out of this data that he'd looked at. And it's a very old school way of looking at accidents in this linear, predictable, convenient narrative that allows you to blame someone. So that is a very old school 1930s model that still drives a lot of our systems and ways of thinking today, for better or for worse. Let's zoom up into the 1980s. And this wonderful model that James Reason created called the Swiss cheese model. I'm sure many of you have seen this before. And the idea behind the Swiss cheese model is that we've got a hazard on one end. And as you can see, the hazard has to penetrate all the way through the holes in these layers of Swiss cheese before it can become a loss, an injury or damage of some sort. What are those layers of Swiss cheese? They're represented by active things and latent things in your organizations. Latent things might be more like your workplace conditions, your training, your procedures, your policies, things like that. More active things might be stuff like supervision, hiring, the equipment that you're using, stuff really proximal to the incident itself. So it is useful in that it invites us not just to think about this static linear dominoes to find the broken domino and fix it, but more to think about the larger organizational aspects that are going on upstream of where the incident might occur. And it is more complex of a way to look at incidents and accidents, but as you'll notice, it's also still quite linear. There's a very linear path that hazard takes through the holes in the layers of Swiss cheese. The strategy with the Swiss cheese, obviously, is add more layers of Swiss cheese, right? Add more policies, add more trainings, add more equipment, add more layers of protection, have better first aid kits, better, safer vehicles. You can keep adding layers of Swiss cheese, and it invites us to be more intentional. But in the end, yeah, this is still quite a linear model that doesn't exactly reflect or represent the real world in which we function and operate. So I'm going to go to the third screen here, which will be a little more chaotic looking, but I think more accurately portraying the real world in which we operate and some very important concepts. So getting away from this linear Swiss cheese, we're going to move into more like the 2000s, and we're going to see a much more dynamic model of interactions between the layers of Swiss cheese, which represents systems thinking. And it's the idea that this is no longer this simple, clean, simple narrative of a linear world that we live in. Actually, what's happening here is interactions between the layers of Swiss cheese, interactions between the hazards themselves and our attempts to manage those hazards. We call these emergent risks. And emergent risks are really important to think about and understand in a COVID context. So let me give you some examples of emergent risks. So we can manage the risk of COVID, but create a new risk as a result of that. Masks. We require people to wear masks. It's a good thing. It protects us from COVID. There's lots of benefits to wearing masks. It also creates new hazards that weren't there to begin with, right? Like foggy glasses or dehydration for people that aren't drinking adequately because they're wearing their mask all day. And you can imagine others associated with that as well. How about driving separately? I bet many of you had a policy or an approach that required participants to drive separately to different trailheads or service projects or events that you were doing. And that's good from a COVID perspective. It also puts more tired drivers on the road and more vehicles on the road. And it's exchanging one risk for another. How about a policy that you might have utilized at some point of not sharing tools to keep people from being close to each other and passing tools back and forth? Again, we manage the risk of COVID, but now we have someone, using a pair of loppers maybe as a hammer and doing that all day long, and either misusing the equipment itself or getting maybe overuse injuries of some sort because they're not using the right tool for the right job. You can imagine many other examples of emergent risks. And that's what we're going to do next, is ask you to deploy yourselves to the breakout rooms with Ricardo's assistance. And what I'd like you to discuss in the breakout rooms is what are some of those emergent risks that you have seen in your programs? Ways that we've managed the risk of COVID, but maybe created new risks as a result. Another question, and we'll pop these questions into the chat, but another question you might look at, if you think about those dominoes or the Swiss cheese or this emergent risk concept, systems thinking, in what ways are you maybe stuck in that old school domino model of thinking? I'll give you an example. Maybe we write a JHA, a job hazard analysis, or some of you might have a different acronym for that. But maybe we write a job hazard analysis weeks or months before the program begins. And we line up our measures of mitigation steps. And then we stick with that the whole project, and we fail to continuously update or modify our thinking. We fail to recognize these emergent risks, and we keep managing the risks that we identified weeks or months earlier. That's like an old school domino kind of effect, instead of recognizing the continuous need to dynamically assess and manage the actual risks, that people are encountering day to day. So the two questions are, what emergent risks do you see in your programs, and how might you be stuck in an outdated or domino kind of way of thinking about risk management? So I'd love to ask you to pop into those breakout rooms. And Jay, I think we're okay to go with the 10 minutes if you're okay with that.
That, I think we've got time. Yeah, I'd love people really to explore this with each other.
Great. So let's give it a shot. Any questions from anyone before we get into the breakout rooms?
Just so everyone knows that there has been an issue where some people aren't sent to a breakout room. So if that happens, they will turn the main session into another breakout room. So you don't have to leave. You don't have, don't feel like you're going to get left out. That's just something that's been happening. So I'm going to put the breakout rooms shortly.
Thank you all. See you back here shortly. Hang with us. let's hear from just a handful of folks. Let's hear a couple of the emergent risks or a couple of the really key learnings that you took away from your breakout groups from a few courageous people.
I can share.
Please.
So we talked about last year and our last year's field season. We talked about driving a little bit, noticing that there were more fender benders, kind of like off-road driving accidents for our course specifically. And part of that is because we did our off-road driving training, we think like half remotely, half in person. And the in-person piece was not with like an instructor in the vehicle like we normally do. So yeah, nothing crazy happened, but just like more small incidents, more small driving incidents. And then like the kind of like mental health toll, I think, on people for always having kind of like the anxiety about exposure and constantly kind of like calculating your own risk and those around you and who you're exposed to, and never really being able to stop thinking about that for some people, or to like be with people who have a different risk tolerance than you and having to kind of not have an option whether or not you accept that. Because you have to interact with them and work with them. And then we also talked about going forward this year and a little bit about kind of our process for how do we keep people from having like COVID fatigue and still continue to engage them as we like see the vaccine roll out, and but are not, most of the people who work for us are not in the category of folks who have been vaccinated. We've already started our programs this year. So I did share a thing in the chat about Brown University has like this My COVID Risk app that calculates your risk based on like how many people you're with, whether they're wearing masks, as well as your zip code, number of cases that are active in your county.
Thanks for that one. I've not seen that one. There's another website called covidactnow.org where you can actually put in county and state, and it'll give you these metrics that are really useful. Vaccination numbers, ICU capacity, you know, caseload, stuff like that. Really useful. I'll check out that one you mentioned too. Aurora, it sounds like you folks covered some really good content in your 10 minutes. So thanks for sharing all that. Maybe let's hear from just one other person, an emergent risk or a domino type concept that you talked about in your group.
Yeah, I don't mind going. My name's Kelly. I'm in Richmond, Virginia with the Virginia Service and Conservation Corps. We're an AmeriCorps program in Virginia State Parks. One of the things that I sort of talked about for us is that we were kind of lucky in a way that since we're with Virginia State Parks, all of the COVID protocols and decisions were made by people higher up, and we just had to implement them, but we weren't having to like figure out what to do. But where we ran into issues is some of the policies had a trickle down effect to us in regards to recruitment and placements and other things like that. For instance, we had a policy for risk management that you could only have one person in park housing regardless of the size of park housing. And so we would provide housing to some of our members, and especially in more rural areas, there aren't rental options. But then what would sort of happen is, say we had a house where you could house 5 people in it, but we could only put 1 person in there. And so then we had 4 people who couldn't find anywhere to live. And so our numbers were down, or our recruitment struggles, or just if we have members who chose on their own to live together, they are still required to go by the state parks vehicle policy, which is only 1 person per state vehicle, regardless of whether or not you live together with that person and are even commuting to and from the park. And so where we really felt it were in some of those sort of trickle down sort of situations and exposures, as opposed to really trying to come up with the policies and procedures.
Yeah, great examples of some of the different challenges that can come. Some of which is in your control, and some of which isn't. Right, like the external organization setting some of those policies and procedures. You are calling in, by the way, from my hometown of Richmond, Virginia. Although I now live in Seattle, so nice to have a voice from the Commonwealth on the call here today.
Yeah, and I used to live in Seattle, so.
Very nice. Well, thank you for contributing those excellent additions to the discussion here. I think in the interest of time, we'll move on to our next slide. Thank you all again, and we're going to go back into the PowerPoint now, which I hope you are now seeing. And Jay is going to talk through kind of converting some of our look back into looking ahead into 2021. And I did get the Mentimeter going again, so we can try that again, Jay, for our last little interactive activity.
That sounds great. You know, one of the things that we did in the Public Land Service Coalition was throughout the summer, we met every Tuesday morning, early afternoon, depending what part of the country you were in. And we talked about how managing COVID was going in the field. And we really learned a lot from each other. It allowed us to learn from other folks' experience without having to do the same, which is always a great opportunity in the risk management world. And one of the things that we also learned was the things that we were going to keep doing, which is another great conversation that we actually had in the small group that I was in. And we'll talk about that in a minute. But what's the difference between where we are now? The first is we've all had a year under our belt, and we've gotten good at things, and we've dealt with a lot of better understanding this disease and its transmission and its impact. We were dealing last year with a lack of federal response. And I want to give a shout out particularly to if any of our federal land management partners are on the call, where the folks on the line were put in this ridiculous place where from the department level, they were not getting the support they need to assure both the public and also their own staff's health and well-being. And that was very, very, very challenging. We also heard this conversation around how different protocols were depending on the agency or depending on the state or depending on the locale. Sometimes countermanding things that we had worked and found to be incredibly effective. And then we needed to deal throughout the year. I don't know if everybody remembers the deep sigh of relief in June, and a lot of our summer programs picked up. We had all of these parents that were delighted to kick their kids out because they had been living with them since the middle of March because there'd been no school. And then by the middle of July, we started seeing spikes all around the country, and they were very, very concerned. And vaccines was a fantasy for the future. This year, we are coming in with all of these experiences and these protocols that we've really lived with and improved and adjusted. But now we have new unknowns, right? We have no idea really how these variants are playing out. We now have an organized federal response, which has been extraordinary to watch. A specific example of where that impacts us, sometimes not as well, is, for example, the shout out to sort of the amazing work that the National Park Service does through its Risk Management Division and Public Health Division. And these are folks that were pretty much put by the sidelines and now are fully engaged in supporting that agency, and other federal agencies are looking to their experience. And they're working on masking mandates, and they're looking at reevaluation of CDC rulings. They're looking at housing. A lot of people talked about housing issues because all of a sudden a 5-bedroom Park Service house could only serve one. And I think they're looking at the science now, and I think that pretty soon that they'll probably announce that they will allow cohabit of buildings, but not bedrooms. So one person per bedroom, but 5 people in a house, if there's 5 bedrooms, sharing a kitchen, because we now understand. So those things are, you know, improving, but may impact our operations because we had a little bit more free reign. And I think we were talking about how we created healthy groups with folks coming in, and how that was assisted by the fact that there was no school. Everybody was remote learning last May and June. And this year, schools are going to be probably uniformly open by the time that we get in. So what I would like to do is we're going to try this little Mentimeter thing again. I want to get a sense of what folks are thinking about in terms of looking ahead. You know, what are the things that you are looking forward to and what you are concerned about? Do you want to add anything to those instructions, Steve?
Not at all. It should be hopefully up and running. You should be able to click into menti.com. There's the code. And you should be able to vote with these little sliding scales. I'd be just curious to see what you all come up with.
Yep. So folks, go into that, and I'm still gonna just chat about a couple of things while hopefully that we can see that starting to populate. But one of the things that was just mentioned was COVID fatigue. And I'd like to talk about that on 2 fronts. You know, one is that one of the things that we certainly discovered by the middle of the summer was that we were having our own mental health challenges. We had been focusing really strongly as an industry on supporting our members and our field staff. And then we also started realizing that we were being dramatically impacted. And I think our learnings around being all co-victims of trauma as an industry has been a pretty large challenge for us. And so it's been interesting to work our way through that. But there's another sort of COVID fatigue that can be challenging to us, particularly in managing risk in our programs. And that's over familiarity. That's actually over comfort with protocols. And there's at least 2 downsides that I can think of, and maybe more with that. One of them is familiarity leads to the fact that all we're doing is just sort of managing that program at the field level, and we're so comfortable with it that if everything goes well, we don't share what's going on up the chain. And Bridget Estep and I ran into this situation when we were doing our data project, whereas a lot of cores came back and said, you know, we don't really have that documentation on how many negative tests. We did a great job on how many positive tests, but if staff saw negative tests, they just moved on. Mm-hmm. And so we sort of lost, you know, our ability to do that. And so there's that realization that we really need to take our good care in sort of maintaining that. One other thing I'll just mention briefly, and then we're going to go to this survey, is that sometimes our staff worked so hard at focusing on the protocols that they forgot about using their judgment. And a really good example of that is that we met every week to look at COVID cases, loads, concerns in our community programs in Tacoma and Springfield, Oregon, and Portland, Oregon. And we realized that we were so focused on the data that we had decided we were going to analyze 6 weeks ago that we didn't ask ourselves the fundamental question, which wasn't what the data was. The question was, these young people that we're serving in our programs and go home every night, are they safer in our program, or are they safer going to the mall, hanging out, doing pickup basketball with their friends, you know, going to the lake and ignoring that, or from 7:30 to 5:30, working with 2 qualified crew leaders, all wearing masks, going through all of these protocols that we were managing, should we look at ICU numbers and decide if they're concerning that we're not going to run our program? And then we started asking ourselves, are they safer with us or are they safer at home? So I'll transition back to you, Steve, with that thought.
Thanks so much. And I should be sharing my screen now. Can you see that?
Yeah.
Very interesting answers. Looks like 16 people voted in the Mentimeter. Thank you all for doing that. And it's, I think if you've taken away no other point from this entire talk, the idea of focusing on COVID as your only risk, you know, I really, it looks like people are really clear that COVID is a risk and it's not the only risk that we're dealing with. So that's a wonderful sort of vote there to see, a result of the voting to see. I'm interested in the first two, this question of managing more COVID cases in 2021 than we did in 2020. And it's kind of leaning towards the left end of the scale on that. And then a little bit more updating and changing operations and things in 2021 due to vaccine availability, uneven and as sort of inconsistent as that has been so far. Certainly the momentum is picking up with vaccines. And I'm really curious if anyone who voted has a comment that they'd like to make or a reflection on, you know, why you're seeing it the way that you are, or if this is the results of the voting, you know, that you were expecting to see. So wonder what reflections people might have. And then Jay, I'll kind of invite you to offer any sort of thoughts you have on these, but I want to see what the audience has to say first.
And we just got our 5-minute warning from our colleague, Alan.
Thank you, Alan. Does anyone want to make a comment about your thinking around, you know, how about we focus on the first question? You know, we are assuming that we will have to manage more COVID cases in 2021 than we did in 2020. There are more COVID cases. You know, we are in a worse place in March of 2021 by far than we were in March 2020. And I'm curious what people's thinking is around that one.
I can jump in and answer. Hi everyone, my name is Teresa from Conservation Corps, Minnesota and Iowa. And really my thinking for the first two is pretty similar. We're not willing to assume anything based on the last year of uncertainty, but we are hopeful that with continued vaccine distribution that we'll see lower transmission, lower case rates by the summer. And so we're kind of in a holding pattern right now of maintaining our protocol until summer and hope that we might be able to shift some things up by June, but not implementing any changes yet.
That's a great detailed answer. And I like the connection you're making between question number 2 and question number 1, right? The interrelationship between those layers of Swiss cheese. Thanks for that, Teresa. Other thoughts?
The same path. My name is Summer and I'm with the California Conservation Corps, and we're pretty much on the same path as Teresa described. We're actually in a better place now than we were last March as far as COVID case numbers. But a lot of that I think has to do with the fact that the holidays are over and people are not going home and doing major group gatherings, because we saw our largest spikes in November, December, and January. And it was really scary for a minute there. So we're definitely not altering anything. The only thing we are changing is because we do have people that are now fully vaccinated, which means they've gotten either their single J&J or their 2, and it's been 2 weeks since. They are not having to quarantine if they leave and come back. So that's about the only change that we have.
Yeah, wonderful. Thank you
And
so much.
Steve and Jay, I think it's time to wrap up.
Okay.
All right, let's
Thank
do
you,
it.
Alan. Well, I'll jump in with a sobering thought that I hope Summer and Teresa are right. And I actually had a revelation about 3 weeks ago, one of those wake up in the middle of the night things, that it's actually, I think last year our theme was preventing COVID on our programs. And I think that this year our theme will be managing COVID on our programs. So I am expecting more COVID for lots of reasons. I'm also expecting that we have a more measured, lower, like alert thing about it, that we are managing COVID. We work and live in a COVID environment. We understand more about COVID. So it will be interesting to see. I think that these protocols and the work and also the connectivity we have with each other will continue to provide a strong level of support to our programming. So I'll just end there and offer my appreciation to all of you and to this community, not just for the work that we do together in terms of managing risk and the safety, but the power of the work that we do and our missions that we go to every day. I cannot tell you how much I miss seeing you all in person at the Core Forum to sort of share that communal pride and success of the dramatic impact that we make, not only on the young people that we serve, but on all the people that those young people touch. So thank you for doing what you do.
And I'll just briefly wrap up by saying thanks to Jay for doing this talk with me. Thanks, Alan and Ricardo and the Core Network for having us. It was wonderful to see some of your thoughts and answers to these questions and your really engaged critical thinking around this stuff. Experiential consulting exists to make the risk management part easier for you so that you can get back to doing your important work and delivering your missions around the country that I personally value so much. So if we brought up anything here today that you would like to ask more about or discuss further, emails addresses are here on the screen, and would really welcome any follow-up questions or conversation. And thanks again for the opportunity to support you in your meaningful work. And we really enjoyed all of your great participation in this conversation today. So let's keep that momentum going, and let's build on what we learned in 2020 and apply those lessons to 2021.
And thank you, Steve, and thank you, Jay, for an excellent presentation and very thought-provoking. And if you all would take a few minutes to go back to the workshop page on Whova and fill out the evaluation, we'd love your feedback. And thank you, Ricardo, for managing the technology side seamlessly. We really appreciate it. Enjoy the rest of the conference.
In general, to the Core Network and all the work that you've been doing to support us.
You bet.
So long, everybody.